Ready, boss lady?
Okay, call this meeting to order, everybody. Ready? Okay, I'll take a motion to approve the agenda.
I move to approve the agenda as presented. I don't see any.
Second. Discussion. So we, number 6, we're gonna keep that to stay 2024. So 2024, that was to clarify what we're doing on that. So we're talking about the annual 24 budget. Okay, all in favor?
Aye.
Opposed? Okay, I'll take a motion to approve the minutes from our September 12th meeting.
So move.
Second,
Second.
all in favor?
Aye.
Opposed? Okay, public comments. Do we have any public comments? Okay. All right, no public comments. Receipt of information from supervisors not seated as committee members. I don't see. Oh, yes.
Well, I have nothing to say.
Okay, let's do number 6. So the 2024 annual budget.
So, honor of the agenda item as it was formerly written, just like to pass out the Q2 results for 23. We can discuss those at a later time, but we've got them prepared for you. I'm not seeing anything that would cause any concern.
Looks familiar.
Right. They all have that sort of same look.
Health and Human Services, the highest budget in part of the county, or is it highway?
Thanks, Don.
I think we are. aren't we?
Thanks. So you've seen this graph before. Today's we're almost at the finish line. In fact, Vince has in his hands our final draft of the first draft of the front matter for the budget book. So compared to last year, we're running way ahead because prior to the October budget meeting at 5:59, our finance manager and I were still printing the budget book. So a little bit ahead this year. Vince will present the actual draft budget to the full board this coming Tuesday. You'll have your draft budget book later today in electronic form. And those of you who'd like a print copy, we'll get you one absolutely as fast as we can.
Don, the old timers say we're on the downhill pull.
Sounds like a farm term to me.
It is.
Yeah, I grew up on a soybean farm and we didn't work very hard. I like dairy farmers. Okay, next slide. One more. So big picture for everyone. So in 2023, we had budgeted revenues of 62.9 million. For 2024, we have budgeted revenues of 63.1. Not too hard math. We have an additional $200,000 this year over or for 24 over. We're going to do a lot of work with that $63.1 million, particularly around employees. And you'll see that in a second. And the way we were able to do that work is by department and division directors taking a very hard look at their budgets for 23, making some tough decisions so we'd have more resources for personnel. We'll get to that. So, let's go to the next slide. As usual, the largest fraction of our revenue comes from from the levy, and we'll get a little bit more detail on that, followed by state aids, public charges around the wheel. Next slide, let's go look at levy. We had a question from Supervisor Hall at General Government in September because we recorded that $5.5 million surplus. And a really reasonable question is, were you overtaxing Polk County taxpayers? I think the credible answer is no. For the last 4 years, the property tax has been really, really flat. In fact, the percentage increase for Polk County taxpayers this year is 0.4%. It's hard to get flatter than that. Next slide. It's a little different story with sales tax. We've been in an inflationary economy the last couple of years. That's helped sales tax revenues. For 2024, we're projecting 4.85 million. We budgeted 4.4 million for 23. So that additional $450,000 really helpful. So we're getting a boost from sales tax. We're not getting a boost from levy. Let's go to the expense side. Budgeted expenses in 23, 65.8. Remember back, the revenues were lower than that. Late in the game, October, November, the board added a number of important projects that were paid for out of the general fund capital projects. That's the difference in the current budget year between the revenues and the expenses. Projected expenses for 24, same as the revenues, 63.1. Let's go to the detail. If you remember, actually, let's switch back one slide because I didn't point it out. Yep. Personnel here 32.3, personnel here 34.2. Big jump. That number for 24 is 6% more than for 23.
Can I ask a question? Is that from increases in wages, additional staffing, longer hours?
Longer hours. FTEs are
Overtime?
flat.
Oh, overtime, no.
It's what we're planning to do, and we'll have another, in a minute, we'll talk about wage study. But it's what we're planning to do with the wage study.
Okay, got it, yeah.
Okay, next slide. I'm not going to go through the detail here. You're going to have it in your budget book. But these are the additional funding requests that Vince has provisionally approved, and you'll see in your budget book, and there'll be some discussion on Tuesday. In fact, I'm going to kind of fly through these slides, if that's all right, if there's no question. Capital requests, next. Operating requests, we have operating requests for 2 additional FTEs from the sheriff. Those are the only additional FTE requests that we've got. We've got a special request for housing. You've heard about that, $200,000. We've said no to, or we've removed a number of requests that departments or divisions put in, a little over $250,000. And then we've got some that are on hold, which means that the administrator hasn't made a decision, about 2.4 million. A big one is sitting right there. You know, we got to do something with that jail at some point. We're not expecting to do anything anytime soon, but we don't want to lose sight of the fact that at some point we're going to have to either take that building down or fix it up. The rest of these things, there's reasons why the administrator hasn't decided yes. There's some signaling going on here. At some point, we're going to need a new financial reporting system. Somebody said all these reports look exactly alike. No. I'm not sure we'll fix that, but we do need a new reporting system. That's it for the additional funding requests. And you'll see these in your packet. Okay, let's go to the wage study. All right, maybe the next slide. So if you go on the website, you can see that we publish a grade classification grid, which shows every job in the county by its pay grade. And we've got from the lowest pay grade is 9 up to 22. It's like a GSA system. We also have a range of wages that occur on any of those levels. And we publish a minimum, a midpoint or market, and then a max. We brought a consultant in called McGrath to help us look at the grid, where we've got the jobs positioned, and how much we pay. They were also looking at our titles for comparability. So steam fitter in Polk County is equivalent to steam fitter in St. Croix County. We can do comparables with that. What they're helping us do is understand whether we're paying the right amount of money to the right jobs. In fact, beginning today, we start to work with division directors where they're going to look at every job in their organization and tell us whether the consultant has it about right. Steam fitter is a 16, it should stay a 16. Well, steam fitter is actually 17. So this is what we're working with McGrath on in the purple area. Next slide. What have we learned so far? We've learned that our grade classification needs work. It's too compressed. We need to spread it out a little bit. We're going to end up with a system with more grades in it. That's going to help us with some compression. That's when folks in dissimilar roles or with dissimilar experience are paid very similarly. We've learned that the pay range itself needs work. And we've been hearing this from departments and divisions, at least since I've been in this role. In particular, at the low end, we've been bringing people in at a minimum below the actual market, which means this must be a great place to work, right? So we're going to do an adjustment on that. Remember, we were talking about how we have 6% more in the 24 budget than in the 23 budget. We're going to do as much as we can to fix that imbalance with the minimums relative to our competitors. Some folks, so please don't leave the room thinking that everybody's going to get a 6% raise. It's not going to work that way. The folks that are being paid less because they were brought in recently are going to get bigger bumps. And those who have been here a while are going to get smaller bumps. We're not going to have a COLA and a merit this year. We're going to have a wage adjustment. Overall, it'll be 6%, but everyone won't get a 6% raise. Our goal is for no one to get less than 5. That's our goal.
Do you know the current, is there a county
Current.
average? I mean,
Yes.
like out in the population, what kind of
What kind of raises are people saying?
raises?
Yep.
Yeah.
So Social Security, which is something we pay, the administration publishes, I think, the day before Vince presents. I think it's the next Monday, they'll put out the 2024 cost of living adjustment for Social Security within a day or two of that. We've been monitoring what's going on with our competitive counties, and the raises, the COLAs are 1 to 4%. So we think we're going to be able to maintain our position with that overall 6%. We're going to make things fair for folks at the bottom end. We're going to be reasonable for people elsewhere in the pay grid. And we're going to maintain our position at about the 75% mark relative to our, we want to be in the bottom of the top quarter in terms of pay for the counties that we compare to. Bottom of the top quarter. So about that 75%. So if you ranked all the counties we look at, we want to be close to the top and not at the top. We can't afford to be at the top. Ms.
Yeah, I mean, it's the same in business. A lot of times there's always that one business that says, we're gonna be the #1 in a lot of ways. And usually they're a flash in the pan, and they explode the pay range. But if we can be there close to that top, we know that we are very competitive. Plus we have other things that make Polk County an attractive place to work here. So, but the key is to be above the average. And being at that 75th percentile gives all of us that comfort that we know that we are being fairly compensated.
And another thing I hope folks won't walk away with, we're not paying people 75% of what, say, St. Croix County is. We're talking about the list of counties and where we fall in that list of counties. We want to be close to the top, but we can't be right at the top.
Don, do you have any idea what Social Security adjustment's gonna be on Monday?
The consensus is 3.2% as of last week.
Yeah,
If you look at,
I had heard between 3 and 3.5, so that is correct.
And what are the counties that we're compared to? Is it our adjoining ones or statewide?
more or less, it's Burnett, and help me out if I missed it, someone in the room.
But just,
Burnett, Barron, Dunn, Pierce, St. Croix, Chisago, and Minnesota. So if you think about it, tough to compete with Chisago because they're competing with Washington. St. Croix is competing with Washington, Metro. So we like to be within range of those, but we're not gonna eclipse those two counties. Not my career lifetime. Okay, that's what I've got for you on budget and wage. And that's the same level of granularity the General Government Committee got yesterday. Vince will be making a presentation on Tuesday. I'm happy to answer any questions. I should say before I do the question thing, the department and division directors did a great job this year. So you go to church and the brass plate comes around, you go in your wallet and you put some money in it. Well, in this church, the plate went around a second time and folks went in and dug a little deeper and it went around a third time. So we went 3 times to division and department directors saying, if we're gonna accomplish the work of this wage study, we gotta really, really look at our budgets. We gotta get them in line because we're not gonna be able to do everything we've done in the past and get this wage study done. So it's a credit to the people sitting in this room. It's a credit to everyone else that is in these meetings like you're in all week that we're able to do this year.
So Tanya, I have a question for you. As that plate kept coming, are there things you're worried about? You know what I mean? That you're saying, boy, we are really gonna feel the pinch on this?
I think we were okay this year, but we've been vocal about next year. 25 is going to be really hard. And I don't know that the financial situation is getting any better for 25.
I think it's gonna be challenging. I mean, you're probably gonna get tired of the budget director saying it's gonna be a tough year. But I don't see any more coming from the state.
Every sport.
They talked about a historic addition to our revenue. Flat, real flat. I mean, we got the extra 562 or whatever it ended up being, but there were so many other subtractions that we had to deal with. So I'm with Tanya. I think it's going to be more and more challenging.
and are there some specifics about next year that you're concerned about? That
There's no more where else to take from at this point. We have scraped, and I don't know if Kathy wants to speak to that as the finance manager for the.
And so for 2024, our big piece is we have a high acuity grant, and then we're doing the WIC merger, the 4-county merger. So we're getting a big chunk of money for 2024. And that the high acuity grant is done in 25, and then the WIC, it decreases greatly in 24. So that's money that was able to offset and make up the difference. So we won't have that funding either next year.
So the WIC merger is a bump in the beginning of the merger and then it tapers down.
Correct. Yeah, I mean, hopefully we're hoping that we're gonna get more caseload, which will help bring up the revenue, but it still is a big reduction from the first year.
The other thing that we had to resort to this year too is finding revenue. So that was a little bit riskier for us than what we're comfortable for in some of our more of our cash programs that we have, mostly in behavioral health. We're gonna be keeping a very close eye in first quarter on what those revenues are looking like. And we'll have to be able to adjust accordingly. And with that, what I mean is if the revenue is not coming in, we're gonna have to make some decisions about our staffing plan. So, we'll be keeping a really close eye on that.
Denise, you started to have a question. Did you have a question? Or I want to put you on the spot.
I mean, I guess I don't know how to phrase it without sounding like an asshole, but.
So go ahead, take a crack at it.
No pun.
Yeah, no pun.
Everybody's like, oh God, here she goes. No, I don't want us to be blindsided by folks in the manufacturing companies around Polk that are like, well, I only got 1.2, or we didn't get anything this year, as happens frequently. And then I know that we have to be competitive, and wages have to be competitive, and you guys deserve everything you get, but all these little sacrifices to address the wage study and try and you can't have a wage study if you're not gonna do anything with it. It's like all those park studies that we spend $80,000 for. They're good to have, right? But then what does that mean for us? Nothing, you know? So I get that we had a wage study. We need to be more attractive. Hiring's hard. But I think that the constituents need to be comfortable with that idea. So when you're pulling stuff out and you're making sacrifices in other areas to pull this together and make it happen, it really needs to be clear to everybody. So I don't have people like, what did they get? 6%. I mean, who does that? I can answer that question. But even better is that we already answer that question. Whether you put something in the news about it, the intentions, so that we are all delivering the same message.
Be proactive.
Yes, that's what I'm thinking. There just needs to, hell, we can't even pass a budget for the entire country, and
It does look pretty good.
and here we are just digging and going after it. And that's important to people at this level. It really is. So I just don't want to be part of something that's going to be kind of similar to what's going on at the state level or the federal level. So
Are you saying that you think we should be doing some sort of preemptive or proactive
I
communication
like
around?
proactive better. Preemptive
Yeah.
sounds too much like a strike.
Yeah, I didn't mean that word. Yeah, exactly.
But like, like proactive, like a message, this message right here. Cause let's face it, how many people like sign in and watch this?
No, we don't have anybody.
Even if you have like 10 people, that's nothing.
Yes, I agree.
I'm done.
Madam Chair.
Yes.
I think if publications can be misconstrued too. I'm thinking if each division manager kind of, presents this as we're just coming up to par, people, so that people don't go out and say, yeah, I got, you know what I mean? It's the word of mouth in a county like this. And so I think if each division manager would just explain, yes, we're getting this, but we needed to bring people up to par and with surrounding, rather than those people were already probably at a higher level than we're starting with, the ones that they might be neighbors and friends or whatever. I don't know, grassroots, rather than try and put something in the paper. It's just totally open for misinterpretation.
Sure.
Madam Chair.
Yep.
At our state convention, we had a pretty stern presentation from our state budget director. State works on a 2-year biennium. Governor presents a 2-year biennium in government. And we are definitely affected by that. And he gave a very stern warning. I think Tanya was exactly right. 25 is our challenge year. We're going to be getting less and less and less from our state biennium. So that, exactly the way your presentation are made, yeah, we're dealing local, but we are so much affected by state budget. That's our key right there. What they do affects us.
Thank you, Brian.
I always hesitate to bring this up because I feel like it goes over like a lead balloon, but we also have hung our hat from past boards on the fact that we keep that 50% reserve number for emergencies and things like that. So as we're looking at areas to cut and everything, it's kind of like, where can we go? Well, that's a life preserver. Like, well, I see some people who need a life preserver right there. You know, what are we saving it for? Like, it's great to be in a good position to be able to act when needed in times of economic uncertainty. And it seems like maybe this is a time of economic uncertainty. So to be clear, what I'm saying is, like, we've had this 50% number statutorily that we've all patted ourselves on the back for a number of years. Is there a certain point where we look at that and still are more conservative than surrounding company or counties and still have a very high reserve number and can alleviate some of the pressures on our budget? Or is it just we sit at that 50% number because we're really proud of that 50% number?
Yeah, I agree. I've always thought we should be looking at that number. So maybe next year we should be looking at that number.
Because if we're talking about 25 is going to be a big difficulty, you know, can we still loosen the belt on that a little bit and still come out more concerned? Because I've asked before how we're comparable to other counties and what that reserve number is. And we haven't figured it out, but you know, if we're that tight in that area, maybe we've got some wiggle room to adjust a little bit and take off some of the pressure.
Yes, and
What does the auditor recommend, Don, for your reserve? What's the percentage? Is it 50%?
I'm sure the auditor makes a recommendation in terms of the reserve percentage.
Did you guys say 40?
That's what they've,
40?
in the past, that's what it's been, I believe.
Okay.
and when I've asked other counties, I've gotten the 35 to 40 range.
We did a review of all of them, and it ranged from the minimum, which is, I think, 30% up to 90%. I mean, they're all over the board, depending on the health of the county. And Mr. Luke, Mr. Bonaprise can remember back in 2007, 2008, when we had no cash.
Right.
And that's not to say that those conditions can't come back again. So whatever it is, the board decides what that amount of be. I will say this too. A 50% number is just a guideline. Any board can dip into that at any time they want. All they got to do is pass a 2/3 majority. So if it's something of need, it's there. So I just take due to my position, I just caution people to remember, think back to 2007, 2008, when we were broke. And
Right along with the rest of the country.
yes.
Yeah.
But who's to say that won't come again? So whether that 50% number is right, it's not for me to decide. I'm just saying, it's appealing to look at that chunk of money and say, let's spend it. But what are you going to spend it on? Operations, you do that and it's gone in a year and you don't get it back. And what we've chose to do is look at things like capital projects, things that we can invest it on and it will stay there and it's a one-time deal. So that's why we're looking at that, at our budget surplus from 22 to use that money. We were fortunate enough to have a surplus. That's how it began. So that's just, keep in mind.
Procedure to dip into it is what you laid out.
Right.
Yeah.
I think Don is a budget director, and I think you're gonna try and maintain that high level though.
Well, I think what we need to make sure that we can fund the operations of the county as long as we're here, and we have the savings account. It's the board's decision to spend the money. I'm in favor of having a healthy savings account. And to use as little of that savings account to support operations, except in emergencies.
Exactly. Right.
I have a couple more questions. Anybody else have any questions? So first question, I wanted to loop back on our conversation last month, which is this whole, I think, I love how you've really laid everything out ahead of time and we've gotten all this stuff since August, basically. But I haven't seen the big kunk. Like we had last year, we got it in maybe September. Looks like we were supposed to maybe get it in September-ish. But I can't sit and look at something in next 12 hours later, make any kind of amendments. So like this committee can't really make any amendments or additions or tweaks to the budget. And so it doesn't really help, like Denise can't hear from Joe Schmo down the street that says they want something and for us to have any time to have that conversation. Because we didn't get it, the big, we got these 30,000, but we're not getting the 5,000. And that's where the rubber hits the road. And we're not getting the rubber hitting the road until right before our board meeting, which is presentation. And then the ship has sailed. So I love this process to there, except for that one piece, which is that we're way behind on the big kahunk. Because I got that last year and it's full of highlighters and work and stickies and, it's not like we don't work these over and we need time to work on that.
Yeah, we don't have a staff.
We do not have staff. Right.
It's just me
I
and
may not
me
have one soon.
hanging out.
I want to revisit that 50%.
So, and I believe that last year you got the budget book the night of the October meeting.
Yes.
Was it October meeting?
Yeah.
But we had seen stuff in here
Yeah,
earlier. We had
We had a draft.
stuff.
You had
Still have
additional
one.
funding requests, like we got last month. Here's what we were looking at today.
We went through a whole bunch of stuff about what the committee wanted. I don't know, help me remember, Tanya, am I wrong about that? Because we talked about that, oh, here we go. You're gonna,
That's
There's
the
always
teacher
that
right
guy.
there. It's got this
Always
green
that
ring
guy.
binder.
I mean, I guess it does, we can argue about it, but I just need stuff earlier than the night before, because I don't really want to have you guys tell me it's too late for something. And,
It's not too late till November.
okay,
You can
So
always.
we're getting a
we don't
draft in our
recommend
email
As
Like-
early as today.
as early as today. So we'll be able to rummage and dig.
rubbaging begins today.
Rummaging begins today or tomorrow or whenever that comes. What we're missing is the ability to do that together.
Yeah.
Until the day before we have the October, but you said that the final is November, so we can rummage and scrounge
But we
together
can't
next month.
rubbage, we rubbage, we work together 1 week before the November meeting.
Our next committee is the day of
Okay, the day of.
the county board meeting.
Yeah, so that doesn't give us any time
That's right.
You know,
to work.
I'll overstep my bounds slightly here.
We'll go for it.
Okay, she might.
You're out of here anyway.
Denise? You're on call.
You're-
I think I'm
In
on.
my mind is it's all year. And when we meet and when Tanya talks to you all and we talk about projects and she comes to me throughout the course of the year saying, here are some ideas, or when you board members set the priorities, the 6 priorities that you have. That's rummaging. That's saying, hey, here's what we need. Here's what we need to address. Now, what are some of the programs to go with that?
Right, and then, yeah, no, you're right, totally right. I guess, but the rubber really does hit the road when you start putting pen on paper.
Right.
And we can have these lofty sort of pieces, but the drilling down part and associating numbers to it is when the conversations need to happen within our committee.
Right.
The rummaging together. So let's rummage together next year. One more. Any other questions about that topic? Before we move on the other? Okay, and the last, do we have anything that was on your list? Any keys, any program department objects that you wanted that look at and make a recommendation? Because we have till November.
We had some early on FTEs, but we were able to figure those out, right? And then Don, we talked last week about that FTE, but that was taken off the table for the quality assurance person.
we talked about, so I'm gonna get 30,000 feet for a second and you can pull me back down. So, so Tanya's articulated a need for a quality assurance
Okay,
person. Seeing some things operationally she'd like to have more control over, and totally understand that. My current understanding is that we have a way to accomplish that in the short term through a contractor. And I think we discussed that yesterday. Maybe a perfectly legitimate request for a full-time person to take on that role. This is an emerging thing. I think it would be fair to say you and I first started talking about this 2-3 weeks ago, max. So I think a real concern for the process is what happens when we've got something that's important to do. We think it's important that it comes up late. And we don't have a great way of dealing with that. You know, we've got 29 or whatever departments and 4 divisions, and there's a whole lot of airplanes in the air. We got to get down on the tarmac. But there are things that come up, not at the exact last moment. This isn't, you know, November 15th, but it's pretty late in the process to be thinking about an FTE, particularly if we have a way to handle the core issue in the short term with another operating category. So
so what's the cost of a consultant versus an FTE? I mean,
I
that's,
think we've been talking about 10 grand for right now.
For an abbreviated
Yeah.
QA process. I will add that our division has recognized this need a long time ago, and we've tried to work it into the budgets. It's just with budget, we haven't been able to do that. So when
So
we
it's-
talked about any last minute or any like wish list type things last week, that's when we brought it up, because it has been a conversation on our end for quite a long time.
so this is something you guys have been wanting and knowing a gap. The QA is for charting or what's
It's
it?
to make sure that we are, what we're putting on paper and billing for, especially with our Medicaid programs, is matching up with the documentation units billed. So we don't get a kickback and from the feds basically saying, we need money back now because that doesn't support that.
Yes,
What
and
you put on paper doesn't.
Forward Health actually had an initiative that they were rolling out this year.
In April, they rolled out a new initiative
Where there was,
related to auditing.
yeah, so they were gonna be doing,
So they're doing-
knock
so now
on
they're
wood,
doing
we haven't
pre-
seen anything.
Pulling notes billing, prepaying us rather than after the fact and trying to get the money from us after the fact. So they're looking at them ahead of time and saying, we're not gonna pay you for that. It doesn't, so it's a shift. So that expedited things for us a little bit, but we have been talking about QA, part of, you know, what our case management process is, our clinical processes, to make sure that we are billing what we're supposed to be billing and it's supported in the documentation.
So is there a regulatory of, sorry, Madam Chair, is there a regulatory, so are you talking like regulatory affairs or are you talking about division quality?
I think it's a little bit of
Both,
both,
really.
because
Both.
Yeah.
I mean, the regulatory affairs piece of that, it's the audit that came down from the state, right, for Medicaid. And they have like a 3-structured or 3-tiered, I'll call it, consequence, if you will, how they're handling issues. And the consortium that we work with for CCS had one of these earlier this year, and it went very well for them. But they have an incredibly robust QA process. And so, you know, it's critical to have a QA process somewhere, and it's something we've been talking about since I came on board in 2017. And the need for that and how do we implement, not just for behavioral health, but just across the board, right? It's a tool for teaching folks. And making sure we're providing the right service for the right level of care that people need. So,
Well, and also it's providing the right coding so we get paid.
correct.
So in theory, this position is making money or keeping us from having to give any not kickbacks, returns.
Yeah.
Right?
Yeah, think of it like a coder in a hospital.
Yeah,
or a
that's what I-
clinic.
that's-
They're making
that's the-
sure that they're maximizing their revenues and that they're not gonna be in a payback or a denial situation.
So in my mind, this is actually not necessarily a budget cost. It's like almost like a grant funded position.
It's an ounce of prevention.
Yeah, right.
You
It
gotta
really
say
truly
what you
is.
do what you say, and trust but verify.
And then you get paid correctly.
So if you're doing, and don't they push you? Don't, I would think that, just swimming in that QA regulatory world for 22 years. So like if I wanted to have a fall protection, if I had guys that were working a lot, girls, guys, I would go to OSHA, get that fall protection procedure that they already got out there, by the way, and just make it ours. And then, like I said, say what you do what you say, trust but verify, right? Is that something that we currently do? So Health and Human Services, if I say, let me see all your procedures, let me see the procedures for your job. And I could come in and do an audit you based on that procedure, that trust but verify kind of thing. And those are usually contractors that do that. Third party people that come in and do those sorts of things. Because you don't want the regulators coming in doing that. You want to know well before.
So would it make sense? I think is kind of where we came out. $10,000 to come and say, do we really need this? To do it, to apply it. And to say, is it another person can do it, or is our current management staff that can do it? And if we do need another person, that's when you put in the big bucks, the $90,000 for next year. We don't know for sure that that's what we need. We don't know for
They
sure.
needed it
Then you
since
probably-
We don't know
2017.
for sure if our staff can't do it. Maybe that's what we need to do. So part of my job is to go through those things and make those determinations. So it's certainly something that if you're ready to say, we should add that, I mean, that's one of those things. Tuesday night, you can say, we want to add another FTE to Community Services Division for quality assurance.
I could make a comment, even with the consultant or the person who reviews and or the FTE, when it comes right down to it, the charging, the coding, the individual staffs do it. And Medicare is becoming more and more detailed and making sure people really are coding appropriately. And that's been an issue forever, but it's getting worse. And so it's still a matter of educating the people who are actually doing the billing and making sure that, yeah, I did that. I can't just put it in this, simple, oh yeah, a visit or whatever. You have to be so specific about each item so that you do get reimbursement.
But that's true, but isn't there, I'm thinking of it in the structure, like you said, a coder, because they're still at a hospital or a clinic. There's another layer behind that.
They come and talk to you.
Yeah.
As a provider about,
Right.
do this better. This is what you need to do. Go back to that chart, redo it. And then so that we get the appropriate, billing, but it still all falls back to the service provider.
That would be what, in my understanding, that would be what this QA person would do, is that backstop. It's how I think, like, okay, you didn't code that correctly. Next time I caught it and changed it, so we'll get paid, but next time it,
Or are
right?
you sure you want to build, are you sure you want to build that?
And it's a tool for educating, right?
Mhm.
And just looking at matrix as far as how are we doing? How can we make it better? Is what we're doing helping it get better? Because it is all about maximizing reimbursement.
Yeah. And just a quick question, this $10,000, that's gonna be a person who's gonna come in and work with the staff for a while and educate people on, these are the appropriate ways to code this? Or what is that person
They're
to
just
do?
looking at a QA,
You're doing the FTE study.
a sampling of the documentation that we've submitted into our.
Be nice if someone would come in and say, give a $10,000 educational.
Well,
session on
we've
this.
provided, we
do
provide
that.
education to our staff, so we have training boot camps and whatnot, but now we trust but verify.
Yeah, you don't, right. So so. Translation into government. So if I want an FTE, I have to do an FTE study. And that's where I look at, I go up to my existing staff and I go, how many hours are you spending on this a day or a week? How many hours are you spending on this a day a week? So everything that gets offloaded into this FTE, now I have what it is and the hours. Now I have a justification for an FTE. Do we
So when
have
we
that?
look-
Yeah.
When we look at our time studies, there's no QA happening when our staff are doing time studies. 100% time reporting, that's not happening. They don't have enough time.
Madam Chair.
Yeah.
I appreciate the vision and the reality that we're talking about. But I've got the feeling that history repeats itself, and going back to when we were broke back in 207, and Doc and Jay and I think some of you younger people feel that we were broke because of mismanagement. No, that wasn't the case at all. As a sheriff, you remember the sheriff sales. And in those days, from 2000 to 2007, 8, there was, you could walk into the sheriff's office over there. And Jay, you remember when there was probably between 20 and 40 places on foreclosure, and there were sheriff sales.
Plastered the whole wall.
The whole wall, and the sheriff would, people would be there. There was probably, it'd start in the morning and I was there and run till noon on property sales. So it just, history does repeat itself. And personnel is hard to find. I think every one of our departments are short of staffs. And when you're short of staff, when you can't fill the things that we want to do that we're talking about, then we're looking at outsourcing and contracting and things like that. And that's very much on the horizon. So I just think that some of the things that we've been through have to be said. And although we're looking at vision and reality and everything, let's not forget the things that have happened and can happen. And boy, when I listen to the state budget director, there's some, everything that we have vision on, it's a good thing to have that vision, but there is reality. So I think that's something that we have to all keep in mind too. Don't ever forget it. When we sat here till 2:30 in the morning, Jay, and trying to put a budget together when there was no money because there was no taxes. And just look at the world we live in. Reality on tax foreclosure and things might not be too far away. And that's what would shut the door right there, and we'd be looking at our budgets.
To be fair, I don't think it's fair to compare the situation we're in now to 2008. That was a historical kind of anomaly, and I don't think we have the same kind of housing market or anything right now that's going to crash in Polk County. Our housing markets, the lending is much different. The housing supply is much different. So I don't think we're gonna get to any point where we're gonna lose out on a whole bunch of revenues because we're gonna have a bunch of underwater folks not contributing financially anymore. And even though I completely agree with you, Jay, and John, I'm sorry, where you're coming from, we can always point to 2008 and say that's a reason we shouldn't do something.
Well, I'm not saying that.
I mean, I'm just saying we gotta be careful in pointing to one of the most historical downturns we've ever seen. Because we're very much not in that situation right now.
Go ahead, Aaron.
Arnie?
Well, it would seem to me that since we don't have a really a QA process, that we would start with least with a contractor and to look at the situation and try to figure out how big a problem is it? And then consider educating our coders if they find deficiencies.
We don't have,
We don't have coders.
The staff has to.
Right?
The staff are the
staff-
coders.
The staff are coders,
I mean, we
Yeah.
have billing, but we don't
Yeah,
have coders.
right, okay, but.
The direct care providers are the people.
Right, but I think since we don't have a formal process, I think that we should at least hire a contractor. Look at the situation in terms of, are we liable to have the state come in and say, you gotta pay this money back? And then you can decide how much work this requires to start this process. You can decide for the 2025 budget, do you need a full-time FTE?
Question. Is that, you had a couple people in the medical field and probably people have been there. So, do you have to follow like JACO or anything like? So do they have any?
We don't have
resources?
joint commission. Here we have state statutory requirements and then Medicaid billing requirements.
And Medicare, we do
And
bill some
Medicare,
Medicare.
CMS.
So is there do you feel like there's a gap that needs to be, or a potential gap that could exist?
Yes.
Because if your answer is a yes, then it is paramount that we do that.
Well, I mean, I think
You
with-
don't know what you don't know.
with what Ford Health has initiated this year and then knowing that our consortium that Lisa mentioned, they do lots of auditing and they will give us kickbacks and they work with our biller who then works with the providers to update the documentation to capture it. So I mean, I would say, yes, there is a gap. I mean, what that looks like. I mean, I think having the contract is a great start, but I'm not sure if that's gonna solve the problem.
Right, and just so you need to define kickbacks, because if anybody out there is listening,
So
it
what
is not an under the table payment.
No,
It's a
what-
kickback of a code, correct?
So they are
right, just-
not just denials of payments that may happen. What they are doing is they say, oh, before we pay this, we want to look at your treatment plan and do you have all this documentation? And if you meet a certain threshold, they will stop all payments until you meet a certain percentage. We have not had any issues, because this is not just for counties, it's for anyone who bills Medicaid.
Right.
And so it's a Medicaid, so in the scheme of it, counties are small compared to your hospitals and stuff. So they just will stop paying us if there are issues. And we have not had any at this time.
Do that for me.
Do you have any idea? Ask this question, but like how much money in refund, reimbursements we might be missing because we don't have this figured out?
I don't know if it's necessarily that we are missing things, but are we incorrectly
That's what I mean.
billing
Oh,
for
you-
things that could potentially have a take back or stop payments?
That's what I'm hearing.
Oh, no, just a quick comment. From the individual point of view, even not looking at it as a healthcare provider, but when you get a bill from your insurance, this was not a Medicaid covered service, and so you're responsible for this bill. I've gone back to my physician and said, or my provider, and said, how did you code this? Because, and if it was not appropriately coded, of course Medicare won't cover it, and it's a huge learning curve. I mean, I've been through a lot of staff, especially when we went to the electronic medical record. It's a huge learning curve. You can't just say it's a preventive visit or whatever. I mean, you have to, if you did this extra, you trimmed this corn, or you did this, whatever it is you did, you gotta put it down as a procedure. You've gotta know that procedures are reimbursed this way and whatever, and it's a huge learning curve. And so the educational piece, I'm sure you're doing, but then you've gotta have time or a reconfiguration of how you do your day or however it is, so that the coding is really important. That's where the money comes from Medicaid.
So what I'm hearing is that maybe there's appetite for trying out this contractor first. This is gonna take us till the end of the year. Is it going to be better, so the two questions, would it be better to do a budget amendment next year if we say, well, we really need this right now, or
After
Um,
these, after you've
continue to,
determined-
and this contractor is like, this is not his full-time, like, that's not what he does, it's a side job for him. So if we're finding that, yep, definitely need this, is the board going to be prepared then to do a budget amendment to add a FTE into our budget? Is that the desired way, Vince, or
Could I offer?
like, we're already on notice that this is going on, right? So
I think there may be sort of structurally an alternative that we haven't considered yet. So, by the way, the deliberative function here is fantastic. If I'm a citizen watching, I think what's happening, great. We have the ability to appoint a limited term employee. So if, this is a discussion, not a commitment at this point, but if we, one of my favorite phrases. If we were to proceed with the contractor and we need to do more, we find out we need to do more, with conversation with Tanya, we can, and with a funding that she has in her budget, by the way, the plate passing that I mentioned the 3 times, a little bit went back to her last Friday. We could look at covering a limited term employee. There are stipulations, can't do more than, if I'm remembering right, 1,040 hours in a year, or else it kicks into WRS and a whole bunch of mess.
WRS
Is the retirement system. They want you to start treating that person as full-time once you hit over it. And I need some help on this. Where's Kim? But I think it's 1,040 hours. So we do have a way to get that much work done without bringing a decision before the board. So we do the contracting, again, discussion, not commitment. Do the contractor, we learn some things. It's heard me say it a lot. Maybe we bring in a limited term employee for half a year, the equivalent of half a year. And if we learn that we need this on staff, we go through the regular budget process to do an FTE.
Is
That's
1,000,
one way to handle
is 1,000, I can't do the math quick enough.
it. That's half time.
Half a year roughly. Okay, so that, because one of my concerns is we've got this 10,000 commitment for the consultants. And I'm hearing that we need really an FTE, which is 90,000. That's in my mind, a big gap in the amount of resources and coding and correct money back to the county that we're gonna get.
Yes, and so
So you're saying that this limited piece might be that gap?
could be a way to get from point A to point C by going to point B.
So the 10,000 is a tip of the iceberg QA, Vince, for 3 programs of our 30-some programs that we run here. So that's, I mean, these are the ones we're going right into the Medicaid, right on, so there's QA that needs to happen in all of their areas. So that's where that justification comes in. However, we'll see what this tip of the iceberg does for us. It's late in the budget, we get that. This committee probably hasn't had the opportunity to vet it out fully. Is that fair?
And will that 10,000 cover pieces of all their departments? Just the Medicaid?
Just those 3 Medicaid programs
Medicaid, okay.
that we're looking at.
And then when the plate came back and gave you money back, is that sufficient to cover?
It would be,
It's been allocated into other needs. But, within the division, they could look at what the highest, most important need is with that additional money that was returned. It's about 100,000.
So there's a part of my, and I really appreciate this conversation too. I feel like I'm learning a lot.
Thank you.
And there is hearing that there's been this longstanding question, this feels like an insurance policy to me.
It is.
You know what I mean? It's like
it's prevention.
they're getting more, this is gonna cost us money.
Right.
The not doing this is gonna cost us money.
Right.
Right? And so the longer we go, so say, and this is not a proposal, this is a discussion, is that what the thing is, whatever that thing is you said, I'm saying
Not a
that.
commitment.
So there's a way that the consultant feels like it's kicking the can down the road, and that 10 grand may just come back to bite us in the butt. That if we could deal with the quality issues up front, that would help fund that position, because we're not gonna have refusals. But I don't know if that's true. But the other thing I just want to say is, I trust you. If you've been needing this a long time, if you say this is a good use of those resources, if you think it's gonna save us money in the long run, I don't think you're like saying, oh, I just, and give me a Cadillac, and a dozen roses. This feels like a fundamental thing. So there's a part of me that's like, and yes, I trust that we have people who have been around this story up, it's not on staff saying, yes, coding matters, blah, blah. So there's a part of me, this is why am I, as a person who's a singer and a voice teacher, nickel and diming the people who are in the trenches every day and have seen this need for a really long time. So.
Well, because to add to that, you're right. I don't feel like this $10,000 is not gonna give us the full story. It's only gonna give us the Medicaid piece of the story. And so if we're trying to build a case for why we need this FTE, we're only gonna have a third or a quarter of the story, right?
That's big
So
part of the story though.
Can I just say that quality assurance, from my team, I've done quality assurance within our team for decades. Quality assurance just isn't about the financial aspects of quality assurance. It's also about staff work performance. It's about efficiencies and finding ways for staff to also maybe not have to case note in certain aspects. It's about that time management. And when we're talking about not having enough FTEs and increased workloads, it's also about us being able to maintain staff and not have them burn out because maybe they're doing things that they really don't need to be doing. So quality assurance isn't just about that financial penalty, or it's also about how we maintain our staff and how we educate our staff to do more efficient work and things like that. So it really is twofold. So I don't want everybody just always get hung up on the financial consequence of doing QA. It also is a benefit to our staff. So for me, I have staff lead workers that have done QAs. They do them weekly on my staff, and it helps build professional development within my team. It helps reduce areas of errors and trending. And when you look at our consortium numbers at the state and federal level, our error rates are probably one of the best in the state, because as a consortium, we do quality assurance across all 10 counties on a monthly basis to really work at not having to pay penalties and to get reimbursements in the future, because we have educated our staff on how to do good quality. So take that for what you want.
Oh, that's good. Yeah, but I appreciate also your point about that we want to maintain staffing, and recruitment is important if you're not looking at an amazing list of, we want you to do everything and all this QA stuff too. And it sounds like it's a supports thing to keep the staff doing the jobs that they're, trained and educated in doing, and having some support on the side to do, right? I mean, I just don't think adding a big dump to our staff for this is the way to get at this.
Diana, you stole my thunder. There's an overused phrase, it's analytical data. It's used all the time. You look at all types of reports, and I jotted some notes here. I said, you look at what you're doing, you look at why you're doing it. Can we do it better? How do we do it better?
And then you bring it back for the benefit of all. And the two things that I looked at, which you brought, is not only the physical well-being, but the psychological well-being of your staff. Let them do what they're trained to do and let somebody else crunch the numbers. So I'm gonna go back to what Dr. Laga said. I think it would be highly important for us to look at somebody that can code those things on a short-term basis. And then are we going to save some money and how do we do it better? Amen.
My comments were because whatever the budget will stand and tolerate, I mean, can we, is there enough money in the budget that we could get a $90,000 person versus a $10,000 to start out with?
Well, it sounds like we have $100,000 given back to you, so I guess it just, we don't know that today, but the decision would be, I guess, in the division to have that conversation about whether or not you want to take that 100,000, put it towards the $90,000 FTE, which is what you're.
Yeah.
Which is every year, by the way.
Right.
And is that a position that is included in the wage study?
No.
So are you spitballing? Are you spitballing 100 grand?
We have an idea of where it would fall on the
Okay.
existing
Okay.
pay grade,
Alright.
so it could be different, I don't know.
So where do we want to go from here today? Do you want to doodle this a little bit? And I think to me, it sounds like it's either, it's a go on either one of these models. And the question is,
Yeah.
consultant and limited, blah, 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 or start out of the chute with an FTE. And hey, can you help us out
I
here?
can tell you what won't work.
Oh,
But this information, you come out to the county board for a full-time, it won't.
You know,
they have it.
thank you. Part of it, that's my responsibility. It is. I take your input and I take your feedback. I've heard very little about this to this point. So if I've not heard anything about it, we haven't gone through the process yet. So I
But
like.
it's been
this-
brewing since 2017. I mean, it's been a need, so yeah. I mean, I think we should recognize that piece of
So
it.
part of the process is to it bubble up to me and we evaluate it and we make these decisions. I like the idea of, let's see what the issue truly is. Let's understand it. We can cover that in a very short-term way to see what in fact is it. Is it something that it justifies an FTE which you pay this year and next year and forever? Or is it something that we could say, let's redirect some of our management? Or let's redirect where our resources are and maybe train people differently to do it correctly. So, you know, I like the idea of, and I think that's the limit of my exposure to this is, do we want an FTE or do we want to see what the issue is and hire, a contractor to evaluate? And I think that's the best process. I think that's what we would recommend.
Okay.
And then at what that person finds, we may do a budget amendment for one of the limited edition.
That's
Something,
certainly an
something.
option.
Do we have
Yes,
to do a budget amendment for the limited, blah, blah, blah?
no, not for LTE,
You don't have to do
So-
a
but if there's a full-time, you do it, if
Okay,
it's
for
justified, then the
FTE.
director or the
Okay.
administrator, whoever it is, will say, this makes sense. If we've got that big of an issue and we can't correct it ourselves, if it pays for itself, it's an easy no-brainer. I'm not sure we're there yet.
So in all fairness to the committee, we work on budgets beginning in April, May, whenever the topic comes up. We're given our marching orders on cut. Knowing now that we need to do our additional funding requests, even though there may be cuts, that might be a change for us.
Actually, that's what I wrote down, Tanya. I was gonna say, I think when we know we have to make cuts, we are very careful when we do an additional funding request. So that might be reasons why we haven't put it on there. When we know, if we're told we have to cut over here, we're not gonna ask for another FTE. But if that's the way we should be doing it, then I think we will change that process for us. But I think in our mindset, that's why we haven't brought it to that level.
Well, that makes total sense because you're being asked to cut. Why would you add something? In my mind, I like zero, I call it zero-based budgeting. And I don't know what the correct term is, but it's this budgeting process where you really look at what you need and put it all in there. And then there's your dream budget or your act, and then you kind of whittle down to actual from there. So I think keeping that kind of stuff in your request gives us something to kind of have this conversation with. So you're right. Don't hobble yourselves before you comes to us, I guess, to say, well, do we need, what do we need here? I can see why you would do that. I would have done the same thing. Okay. Are you clear on where we're at? It sounds like consulting 10,000 LTE. Does the committee agree with that? Are we versus a full-time right out of the chute? Because it sounds like our guidance here is the FTE idea is dead on arrival.
I think something's better than nothing. And the idea of having it be a learning and analysis baseline.
We need to take temperature where we're at.
Yeah.
Yes, thank you. Thank you. What is the risk? I'm risk aversion. I'm so sick of trying to talk people into doing the right thing when they can't see the benefit of it. You can't,
Yeah.
you have to have, you got guys working up and girls working up on a tree or up on a ladder. And you don't have a fall protection program because it costs too much money. And that person falls and dies and now where are you at?
Well, I
Or
think
falls
there's a
and
number
hurt
of risks,
themselves.
right? There's
Right.
a burning out of our staff. There's,
I think you need to put it together.
are we, are we over serving consumers? There's the potential of that. Does that mean then that they give other people who are not being served? So I think there's a variety across the span of the service that we provide that there could be risks, but we're not gonna know what those are until we at least get a baseline of, what does it look like? That gives us some tread then to say, okay, we need to delve into this deeper. What does that look like?
And is this audit or this person that's coming in, are they gonna have a statement of work that is like clearly defined on all of that?
And sort of my hope is that we are developing an algorithm as well to continue that QA process to say, okay, this is how he comes in and these are the things he's looking at. These are the results of that. How can we continue to use that metric, if you will, to do additional QAs?
Right, Lisa, there's other risk in the county. There's risk at the jail. I mean,
Absolutely.
risk at traffic stops, there's risks of going, so that would give you hopefully, a model that you could push out to the rest, and then maybe justifying an FTE is a done deal. Because if the county has nobody that's has a pulse on regulatory affairs, I mean, Leah's not here. Malia's not here. I'm sure she had plenty to say about risk and rule following and stuff, but
And semantics, there's a lot of semantics in code. It's what you, they're not gonna pay it if it's not in your.
Yeah.
So you're talking about this person, is this consultant already somebody on your mind or is this
We're ready to go.
ready to go? That's
And the
what I
good news is that we've got about $100,000 to pay for contractors next year.
for professional services.
Okay, anybody else on this topic? Are we good? Thanks, Don.
Good job.
Okay.
These people deserve. a
Where
big
we at
raise
on
over
the
here.
Okay, we're at number 7. Update regarding housing.
Yes, I just wanted to give a quick update on that. Claire, if you could put that, there you go. As we stated, our resolutions that were passed to create this housing loan fund of $200,000. The next step was to create an application. a way to begin communicating with each of the local governments. Say this is available, here's the application, and that's the starting process. This application has been reviewed by General Government Director, our Corporation Counsel, and myself. And we will present this Tuesday night to the board. As long as there are no major objections, we will then send it out. I will be communicating with the local governments and answering any questions they have. We don't know how quickly the uptake on this will be. But I think there might be a couple of communities that are saying, we got something in the works, anything will help, and they may do it right away. And the way this is designed, one of the questions is this a rental project or whatever? You click on that and then it drops down into some new areas so that we find out, is this gonna be something that is taxable? Or is it something that is not for profit, that we would receive no taxes? You know, you look at some of the communities, they start with a rental property and it becomes something that does not even generate tax revenue. So we got all kinds of questions on there. And then once we get the applications, if they meet the criteria that we're looking for, then we go to the General Government Committee for them to sign off on it.
So I have a question about the, great job on all the drop downs, and
Yeah, that's really good.
it's really groovy. There was I do acknowledge the stipulations and I do not acknowledge the stipulations. Help me with that. You know, there's that long list of stipulations further up, and then it says, I do acknowledge and I do, or I do not. And that was a little confusing to me.
So
Here.
can I address that?
Oh, yeah, go right ahead. Yeah, I mean, that's just like anything you sign that says, here's what it's for. I acknowledge these stipulations, and it's just a way to say, wait a minute, now you're building a $2 million lake home for a guy from Minneapolis who's gonna be here, you know. That's just a way to say, make sure you read these things. That this is what it's
Yeah.
intended to do.
Okay, that
Type of
doesn't make
house.
sense to me at all, but
Well, I think.
Go ahead, Don, or
No, go ahead.
Just take out the I do not. Is that what you're
Yeah,
saying?
is it legal to, have a choice? I mean, obviously, if they say no, they won't get it.
You will get it.
yeah, so it's like that, if I read those stipulations and said, oh, it's the 2 million Minneapolis guy, then I would not finish,
You're done. You're
then
done.
I'm done. So that's, anyway,
Right.
if there's a reason, I'm open to hearing it, but it kind of made me go like, what?
Well, you're done.
You're done.
It's a safe.
Abort.
So is it a contract though? Does it become a contract?
well, it's a written statement. Yes, it's
So it's like
whoever's
a
filling this
promissory
out. It says you gotta be telling the truth.
Yeah.
And what that does to me, when I see those things, I acknowledge, I go, oh, I better go back and read them. Cause usually you go down and you just start filling the stuff out.
I feel like they're saying maybe it should be reworded to something that says like, I confirm that my application follows the
Yes.
stipulations of this program.
Yes.
So you could make it like a,
And then it's just one button
Yeah.
that you click rather than.
Well, I'll refer that to our corporation.
Yeah, I mean, I don't,
yeah, like a
I don't want to
promissory
I don't
note.
want to be redesigning a forum in our committee meeting, but I did just, that made my question marks pop around my head, and it just was confusing to me.
Okay,
So
thank you.
That's
Anything else? Okay. Okay, Helen, who's doing communicable disease?
I got it.
Awesome.
So September was relatively uneventful. Chlamydia last year at this time was 8 cases. This year we had 3. COVID, 103 in September. Last year at that time was 210. Lyme is holding steady at 8, and just kind of a 1 or 2 other kind of random anaplasmosis, blastomycosis, that kind of stuff. The really cool, exciting news is beginning November 1st, COVID will now be reportable just like flu. So medical centers only need to report if someone's hospitalized for over 24 hours or if it's a pediatric death. So it just positive, negative, we're not looking at anymore. And that's also the same as RSV this year too. So RSV is now reportable for hospitalized cases or pediatric deaths, just like flu. So it's nice that everything is aligning.
So COVID cases are reported, whether they're hospitalized or not. Is that what you're saying?
Now only if they're hospitalized. Well, starting November 1st, only if they're
Okay.
hospitalized.
Okay, which is the way it is with flu.
Correct.
Okay,
And RSV is gonna be the same.
Correct.
got it. And where are we at with the new vaccine? Is it out and about?
It is out and about.
We have it
yes.
here. Can we offer it to people or are we not doing that this year?
We will be. So we will be offering flu shots and then we will be offering only, it's called the Bridge Access Program. So it's only for uninsured or underinsured
Okay.
folks.
Okay.
Otherwise, we're kind of encouraging them to go to their medical provider or
So
pharmacy.
all the clinics now are up and running.
Oh, yeah.
Okay,
Yeah.
Yeah,
I'm
okay.
getting mine in.
Yeah, I'm not sure if St. Croix has it yet.
well, that's what I'd heard was somebody had said, I tried to, so I just was.
It's their work. I know Walgreens and CVS is up and rolling.
Yeah.
I think everything else is taking a little bit longer because they made that switch to commercialization when it was approved and then when people start expecting it. So it's just a lot of pieces that people are frantically trying to put in
Yeah,
order.
there's
to
a
get
lot
it
of pieces.
rolling. But it's coming down the line.
Okay. Anything else? Questions?
Well, I
Yes.
was gonna make some comments. I just listened to Mike Osterholm's podcast for an hour last night and earlier in September, there was a kind of a surge of COVID cases. And first week in September, there were 16,000 people in the hospitals through the third week. And now the last week in September, it's down to about 15,000 people in the hospital. But there were 450 deaths per week in July. Now it's about 1,000. 1,100 people are still dying of COVID. And there have been some question whether the new vaccine is going to be effective against the new variant, BA 2.6 and ET5. And Mike Osterholm's opinion is that it is. I'm not going to read everything here, but I've got some things I marked here. The people who developed the mRNA vaccines Dr. Caricia and Dr. Wiseman just received the 2023 Nobel Prize in Medicine.
Yeah.
Which is really very, very thing. And he is urging people to, especially if you're elderly, get the RSV vaccine. Because deaths related to RSV can be similar to the flu vaccine. And currently, the infection rate in influenza is very low at least in the Twin Cities and our area. So he is still urging people to hold off on getting the flu vaccine and wait and see, which is what I do every year. And because you don't know if the big surge is going to come in October, November, or December, or is it going to come in March, or if at all. So generally, when I hear people talking about flu cases starting, this when I go get my flu shot.
I can't tell you how many people I've told that to. So thank you. It's spreading the gospel.
Yeah, so the elderly and the other thing I think is important for people to realize that people, even if you've had the COVID infection, your immunity wanes over months. So you potentially can get another infection, another round. And the more rounds of COVID infection that you get, the more likely you are to get long COVID, which is 3 months or more of symptoms. And so I think so just because you've been infected doesn't mean you shouldn't get the booster whenever it becomes available. So I would that's the main message I can say. And I maybe mentioned that last month that one of our close personal friends at RSV last year, are my age, and she was sick for about 2-3 weeks, you know. And so it's not something to mess around with, you know, either. And so and then there was also a discussion again about prion disease. Prions are little particles that nobody believed in until Dr. Stanley Prosner got the Nobel Prize 1997, and he presented his findings and story at the Nobel conference at Gustavus Adolphus College. I can't remember, probably 20 years ago, and so it was an interesting discussion, and so that's what causes mad cow disease, chronic wasting disease, and we're seeing more chronic wasting disease in northern Wisconsin, northern Minnesota. So I think urge your friends who are hunters have their meat tested. So that's my report for today.
Okay, number 9 is legislative event report. John, have you updated us? You're pretty.
I don't know if everybody got that message of, we had our state convention, what did I say, the 17th? And the big thing is, it all started with our steering committee. We have 4 steering committees a year. And I presented 5 resolutions from Polk County. There had never been any resolutions approved by the General Assembly. And all 5 of them got approved. The biggest thing in this committee was in the legislature budget, the governor and legislature agreed on pretty much the same amount of money for county nursing homes, but they redistributed this money. So last year, where Polk County got, I think, 900 and something, the bigger counties which are losing money, they redistributed the money, and now this year, I think golden ages of just approved like for 94,000, and we'll never be able to operate with that amount of loss. So thankfully for all you people, and that we did get that approved, and hopefully, and contact your legislatures. I talked to 3 of them yesterday, and they were in session last week. And so hopefully that we can get this back to survival on our golden age matter. The thing that when I spoke before a little bit on some history, and Jay and I are just chair and vice chair, we're just trying to coordinate this, what we hear from this committee to the other 4 committees. If we need another a person, well, we have to sell that to the other 4 committees, because we aren't just an independent committee. We have to have the 5 committees working together, and that's why you gotta appreciate that Jay is sitting in on the committee, because we're trying to work with all these department heads and with our budget directors and everything to bring everything from the county together. That's what makes the success of the county. So Jay and I need a lot of help in trying to do that. We work on a lot of outside things. Maybe you didn't understand kind of what's happened in the past and what's happened in the future. And we're trying to bring that all together so we have the scope of things. And we go to a lot of different other meetings. I went to, I used to have a real estate license myself, and went to a real estate meeting this morning from 7 to 8. And you just learn a lot of things that are, we gotta recognize what's happening in the future. But one thing that the real estate people are really looking at is foreign investments. It's gonna affect us down the road. So sometime when we talk about things that don't really affect this committee so much, it affects the total county, right, Jay? Amen.
Thank you. Do you want to give an update on this?
That and this that we passed out, this is the 15,000-foot draft of the 24 budget for you
Okay.
guys. So public health is the top page. You guys don't need to worry about the corporation council, but look at the one, so that'll say corporation council. And then underneath, look for the one that says child support. So you kind of gotta look at that. I mean, you, obviously you have access to corporation council's budget, you have access to all of them. Just that corporation council doesn't report to this committee and neither does ADRC, but. I
They
mean, it's
used to,
all-
but not anymore.
No, they've always had their own governing board, so it's just that dotted line because it's a human services department, so they dotted line it to us, but Laura has her own. Aging used to, maybe, no, they always had their own, so ADRC. Obviously, you have access to all of their budgets. I haven't had a chance to go through these yet, so if you look at them and you have questions, let us know. But it does a nice job of spelling out what our revenues are projected. Projected expenses, FTE count. So that gives you a little bit better idea of what the proposed budget is looking like.
Okay. Thank you.
So you can fine tooth comb these and let us know if you have questions.
Okay.
Actually, let Sherry and Don know if you have questions.
Here, give an update on this.
Yep, so Corby Stark in the Behavioral Health Department has been participating in a Department of Justice grant on abuse in later life. The third phase of that training is that they're coming here on Thursday, correct, to provide some training to us. I don't know if the registration is full or not.
It's not, actually, I've checked with Erica, it's not full.
Okay, so there's still room if you do want to join on. It's in the morning.
8:30 to noon.
Chair Middleton is doing the welcome, right? And Corby's connected with you on what we need from you for the welcome. And it'll be a really good training, a really important topic for an up and coming issue that we're seeing with our population, especially aging in Polk County.
What is the topic again?
Abuse in later life. So elder abuse in later life. It'll address financial abuse, emotional abuse, neglect, those types of things that our Adult Protective Services Unit investigates all the time.
Where's this person coming from?
They're coming from Madison. I
Madison,
believe.
That's all right, I
There's
just
two
wanted to
trainers
see.
coming from
We have
Madison.
executive then.
It's up, is it upstairs?
Oh, yeah.
Yeah, I believe it's up in
East or West County?
West, yeah, not West, but yes.
Okay, anything else on that?
We'll be looking, subject matters, right?
Yeah.
You're looking for that?
Yeah, so you're ready. I'm ready for that one now.
Once a year, we go down to Golden Age Manor. I just checked with Dana and she's fine with us going down there next month.
November.
November, do you want to plan for that?
Yep.
Okay, and then we have Golden Age Child Support VSO updates, legislative events, which it should start winding down a little bit, right?
It's a little bit better after our budget is passed. And remember, we're working in that 2-year biennium,
Yep.
so.
So didn't we just have an update from BSO?
He was last month.
Yeah.
And that's something that Shabana and I are working on streamlining for the work plan next month. So we get them here when they need to be. So we're gonna get something better.
Because we don't need him to come next month, I don't think. Do you? Because he came,
We just follow the previous work plan. So if that's something, if he doesn't need to be, I'm sure he'd be fine with it. Unless he has breaking news for you guys.
Yeah, I mean,
Yeah.
I don't feel that since he came in,
He's every other month, right?
So child support also spoke last month too. Do you want them?
Let's look for a GAM, I don't know, maybe
Can we
not.
put them on a quarterly rotation?
That's what we're looking at.
Yes.
Yeah, we were working on, because we had them as updates and then we had also mid-year reports, last year's annual reports. So they were supposed to present different things, but I think some of that stuff kind of got muddled a little bit. So that's what Tanya and I
Yeah.
are working
Yeah.
on
Really tough there.
regrouping for next year. So if you do want to just get through basically the next 2 months of telling us what exactly you want to hear, and then we'll clean that up for
Okay.
next year's plan.
So I would say unless somebody has something burning for Andy at VSO, he does not need to come
Okay.
to GAM. And similarly, child support, they were just here, I think, unless there's something burning that they want to talk to us about. But we'll just go to GAM and be there and then pick up what.
Next meeting at 9 o'clock at Amory.
Yep.
Thank you.
Okay, I'll take a motion to adjourn.
So move.
Second? Oh, so moved. All in favor? Opposed, same sign. Bye, thank you so much.
Does anybody have kids?
Folks that were.